Hello, my name is Victoria and I am a level 2 BScN student. I am going to be doing a video on the technique of injections today, along with the proper techniques and how to appropriately administer the medication. So one of the first things we want to consider is all the 8 rights of medication administration. So the right patient, the right medication, the right reason, the right dose, route, frequency, time, and location of the injection. And we also want to look at our MAR to compare what we are giving to the patient according to what the medications that we have to ensure that they are accurate. We want to check the MAR 3 times, twice before while getting ready for the injection and preparing for the injection, and then once again at the bedside. So to begin, you want to take a look at your patient. You want to look at their body size and their mass, the level of fat or weight. This can help you to decide the needle size that you need, when the gauge and the syringe size that you need when injecting the medication. So I have collected our needles for the injection. We have a 22 gauge here. That will be used for the intramuscular injection. Gauges depend on the length of the needle as well as the size, the diameter of the needle. So you'll use different ones for different techniques depending on how deep you want to go in the patient's skin. The other one we have is a 23 gauge, so that will be used for a subcutaneous injection. Typically you would use a smaller size for the subcutaneous injection, such as a 25 or 24 gauge. Another thing that can differ on your needle is the size of the syringe. So there's 2 things that you mainly look for when choosing your syringe size. First of all, you want the scale to be accurate to your dosage. So you want the decimals to show up to what number that you need to inject in, so it can be accurate. As well as you want to choose a syringe with a shorter pullback, so that it's more comfortable when injecting the medication. So the first medication I'm going to get ready for, I'm going to do hand hygiene. This is the subcutaneous injection, and it is heparin. The order calls for 5,000 units, and there is 5,000 units in the vial, so that is going to be 1 milliliter of medication. So I'm going to begin by preparing. I'm going to open this needle, and this is a multi-use vial, so I will be cleaning it with an alcohol swab to ensure appropriate safety techniques and infection control. So I'm just going to make sure I wipe the top of the vial. Okay. So as I said, for this I'm going to be using it's the subcutaneous injection, so I'm using the smaller gauge. It's actually a larger gauge, but in reality it's a smaller diameter. So I'm going to be pulling the needle out. I'm going to pull back on the syringe because you need to inject air into the vial. So I'm going to be pulling back to 1 ml, which is what I need to inject into Mr. Mancini. So I'm going to take the sheath off and inject into the vial. I'm going to inject the air in and then tip back, and using the pressure will generally bring back the medication that you need, but you can guide it with your thumb as needed. Okay, so I'm going to pull out of the vial and tap for air bubbles. And then I will be injecting up to the level, or pushing up to the level and injecting any air bubbles or extra that I may have. So there I have the vial set at 1 ml. Next I will be putting the sheath back on, using a one-hand technique to ensure that I do not end up poking myself. I will be applying the label to the disposable sheath with the patient's name, the dose, and the medication name, just to ensure that that doesn't get screwed up or confused. Now that the label is on and I'm all ready to go with that injection, I'm going to dispose of this in the appropriate receptacle. None of that is sharp, so that can just go into the garbage. Next, I will be preparing for the intramuscular injection. So I'm going to perform a hand hygiene. And again, this is a multi-use vial, so I'm going to clean the vial to ensure aseptic technique. So this is an order for Halidol, which is the antipsychotic medication. What we have in stock is 4 milligrams per 2 milliliter vial. So the calculation for that is we need half a milliliter, 0.5 milliliters. So I have cleaned the vial with an aseptic swab because it is a multi-use vial. And next I'm going to open up the needle, which is again my 22 gauge for my intramuscular injection. So again, I will draw back. I'm going to remove the sheath. I'm going to go into my vial, inject the air, and flip. And I'm going to guide that with my thumb, although the positive pressure will also bring the plunger back. So I will remove that, tap my medication to get any air bubbles to the top, and remove the excess in allowing the air bubbles to go out. So next I'm going to apply the sheath in a safe manner using the one-handed techniques that I don't stab myself by accident. And I will be applying the label to this one again, Halidol, 0.5 milligrams, or milliliters, and the patient's name, Mario Mancini. Next I'm just going to, again, dispose of the garbage in the appropriate receptacle. It's not sharp, so it's just going to go in the garbage. So next, we are going to enter the patient's room. Our injections are all ready, so before we enter, we're going to do hand hygiene and put on our gloves. Okay, so I'm going to walk into the patient's room. Hello, Mr. Mancini, how are you today? That's good. I just want to confirm that your identification. So I'm just going to look at your wristband here. Can you tell me your name? Perfect, Mario Mancini, and that is what it says on our documentation too. Mr. Mancini, can you tell me of any allergies that you have? Codeine. Okay, I did note that on the chart, and I just wanted to make sure that you didn't have any allergies to any of the medications that I'm giving today, if that there's going to be any interactions. I just am here to let you know that I'm going to be giving you your medication today. I have your two injections. Your one is your heparin, your anticoagulant, which is subcutaneously, and your other one is your Halidol, which is your antipsychotic medication, and that will be given intramuscularly. So if you feel any pain, you might feel a slight prick when we put the needle in, and if you feel any pain or anything like that, let me know, and if you have any questions, you can also let me know, all right? So the first one I'll be giving today is your heparin. So that is 1 milliliter, and that will be given subcutaneously. So the best spots for subcutaneous injections are the anterior aspect of the arm, the abdomen, or the anterior aspect of the thigh. Today I'll be giving it in Mr. Mancini's thigh. I'm going to begin by palpating the region. So I'm going to look for any lumps, bumps, or masses, and I would not want to inject those spots if I have any. So I don't feel any lumps, bumps, or masses, so I will be using my alcohol swab, and I'm going to clean the area. So I'm going to start in a small circular motions and going outward. Ideally, you want to clean the spot for about 2 minutes. And you're going to circle outwards. And we do that for infection control measures because we would like to make sure that the spot is cleaned and we're not injecting anything in that would be like bacteria or cause harm to the patient. We're going to let that air dry. And we're going to get ready with our injection. So I'm going to pull the sheath off. For a subcutaneous injection, I would like to inject at 45-degree angle. So I'm going to pull the sheath off and injecting at a 45-degree angle with the glove up. And so you're going to slowly inject the medication. And pull it. Next, I am going to put the sheath back on appropriately so that I do not cause harm to myself, and dispose of it within the sharps container. Heparin is an anticoagulant drug, so you want to make sure that you don't press or rub the spot that you inject it into prior to the injection, just because you don't want to cause bruising or excessive bleeding to the patient. The next medication I will be injecting is the intramuscular. This is the Halidol for the patient. The spots that are appropriate for intramuscular injections include the deltoid muscle on the arm, the vastus lateralis on the leg, and the ventrogluteal. I will be injecting into the vastus lateralis. So again, you're going to palpate the injection site. You want to ensure that there's no lumps, bumps, or masses. I don't feel any lumps, bumps, or masses, but if I did, I would choose a different injection site. I'm going to use my alcohol swab to cleanse the area. So starting small and going larger. Again, you want to cleanse the area for 2 minutes. So now I have used the alcohol swab to clean the skin, so I'm ready to do the injection. I'm going to remove the sheath, and I'm going to inject at a 90-degree angle for an intramuscular injection. I'm going to pull the skin out of the way to make the Z-track pattern and inject downwards into the skin. I'm going to put the injection in slowly but not too slow, and then you'll leave the needle in for about 10 seconds. This helps to ensure that all the medication is absorbed and does not leak back in. You're going to remove the sheath, or remove the needle, and you can let go of that skin. So that ensures that the Z-track happens. I'm going to put the needle back on and dispose of it into the sharps container. And now I'm going to ensure that I document the injections. So you want to document what you've given and that to the patient that it was. You also want to ensure that you document just exactly what happened, if anything went wrong, or if there were any complications, anything like that.